Good morning, everybody. My name is Dr. Ogechi Sylvia Eze, soprano doctor. I'm here to talk about World Prematurity Month. Yesterday was World Prematurity Day, and it was marked by the medical students who are preparing for our quiz competition. They did a lot of videos, and we are so grateful to the benevolence of Dr. Chris Ufondo, who is the founder of Snowspirations, where he talks about pregnancy, where he talks about fertility, and where he talks about child mortality. I'm very grateful for his contribution. He is coming from a personal place. His precious daughter, Zara, was born at 26 weeks. 26 weeks, just imagine, that is about barely 7 months. And she was taken care of in the NICU. NICU is what we call Newborn Intensive Care Unit. And this girl today is a healthy, bouncing, intelligent young girl. World Prematurity Day is important to draw attention to the challenges faced by these parents of premature children, as well as the complications that these children may have and challenges that they may have in life. We need to know what are the things that cause prematurity, what are the challenges faced in the hospital. Some babies don't survive, some of them have to be put on oxygen, some of them have to be fed through a tube, some of them have to be given drips to replace electrolytes and vital nutrients. Also, when they are discharged from hospital, the parents need a lot of support. These children need a lot of care, a lot of kindness. Sadly, some people make fun of premature children. In my language, we say it is which is they are not strong enough. I would implore that in this month of November, which is World Prematurity Month, we educate ourselves, because it could happen to anybody. People go into pregnancy hoping that, oh, at 9 months, I will deliver like a Hebrew woman, even if you're not a Hebrew woman. But things happen, and you need the knowledge to know, what do I do? Should I go into premature labor? You need to be knowledgeable so that you can ask your healthcare professionals, is my child having what the child needs to have? And also family and friends, please, much more empathy, much more kindness, much more love. Yes, to celebrate World Prematurity Month, this evening I will be uploading the videos of these wonderful, intelligent, beautiful medical students. I'll be uploading it. It will be uploaded on my YouTube channel, which is Health and Music with Dr. Oge, with permission taken from the participants anyway. And I would advise that please add Dr. Christopher Ufondo on Facebook. He founded Snowspirations. He does a lot of education on his Facebook page and Facebook Lives. And if you're wondering what this is, it's beginning to look a lot like Christmas everywhere you go. All right, thank you very much. The soprano doctor here with you.
Good morning, everyone. I'm Okoli Nmesoma, 211 medical students, and today I'll be talking about prematurity. Prematurity is a term for the broad category of neonates born at less than 37 weeks gestation. Some of the risk factors include maternal indications such as previous premature births, pregnancy-induced hypertension, maternal diabetes, eclampsia, multiple gestational pregnancies, tobacco or marijuana use, maternal age. Some of the complications include severe infections. Premature babies are at higher risk of developing infections and at higher risk of dying once they get an infection. Respiratory distress syndrome. This is due to lung immaturity and lack of surfactants in the lungs. Jaundice is more common in premature babies since their immature liver cannot fully metabolize bilirubin. Brain injuries such as intraventricular hemorrhage, heart problems such as patent ductus arteriosus, anemia of prematurity. This is because of delay in production of red blood cells since their bone marrows are not yet mature. Now, how does this affect their parents? Women with preterm babies are at increased risks of ill health and negative feelings toward their premature babies at early months of delivery. Research shows that postpartum depression is more likely to occur in mothers of preterm babies. The financial burdens that comes with taking care of premature babies too. Now, the management. Respiratory management, thermal management, fluid and electrolyte management. In respiratory management, administration of surfactant is recommendable. In thermal management, a desired temperature of 36.5 degrees Celsius to 37.5 degrees Celsius, it's important. This could be achieved through use of incubators, or in places where there are shortages of incubators, the kangaroo mother care comes in, which involves direct skin to skin contact with the premature babies to ensure warmth. In fluid and electrolyte management, it is important that there is a regulation of. In fluid and electrolyte management too, it's important that there is a close monitoring of glucose and electrolyte levels. Glucose in the initial fluid could be glucose and water. Calcium fluid too could be added. Now, in follow-up, you should ensure eligible families are connected with a neonatal follow-up clinic, and you should also monitor for executive functional difficulties in school-age children too.
Good morning, everyone. My name is Joseph Gbogbo, and I'm a third-year medical student at the University of Maiduguri. This morning, I'll be talking on prematurity in commemoration with the World Prematurity Day. Prematurity can be defined as a condition where the birth of an infant occurs at least 3 weeks before the due date. That is, the birth of an infant before the 37th week of pregnancy. Prematurity can also be called preterm birth, and the infants are known as early term infants. The exact cause of prematurity is not exactly known, but certain factors can increase the chances of having a preterm birth. These are the risk factors of prematurity, and they include, but not limited to, high blood pressure, overweight, chronic conditions like diabetes. Prematurity can also occur if there's been a previous premature birth. It can occur as a result of an infection to the amniotic fluid or genital tract. Increased mental stress can also cause preterm birth. In prematurity, both the child and the parent have issues that they suffer for. This will be in the complications of prematurity in the child and in the parent. For complications of prematurity in the child, I'll divide it into the short-term complications and the long-term complications. For the short-term complications, the child can experience breathing problems like the respiratory distress syndrome. The baby can experience heart problems like low blood pressure or patent ductus arteriosus. The baby can also experience brain problems, temperature control problems, gastrointestinal tract problems, amongst others. For the long-term effects of prematurity in the child, this child can experience cerebral palsy, impaired learning, and hearing problems. Complications on the parents includes, but not limited to, increased financial burden, serious mental stress, and in some situations, social isolation. Now, the management of prematurity. I'll divide this into supportive care, medicine, and surgery. For supportive care, it includes placing the baby in an incubator, monitoring vital signs, having a feeding tube, placing the child under bilirubin light in cases of jaundice so as to increase the breakdown of bilirubin. For medications, diuretics can be given. Surfactants can also be given in situations like the respiratory distress syndrome. And in other situations, surgery can be carried out. For follow-up, after the child has been discharged, there should consistently be medical tests in intervals to check the vital signs the growth and other factors that would have been affected as a result of the complications of prematurity. Thank you so much for listening. God bless.
Good morning, my dear colleagues, senior colleagues. My name is Amatemeso. I'm talking on prematurity. So the baby is then premature if it is born before 37 completed weeks, but after the fetal age of viability, which is 28 weeks in Nigeria. Before then, it's then an abortus. So the risk factors for prematurity, there's no known cause, but there are many risk factors. These include maternal medical conditions such as diabetes, hypertension, preeclampsia. Multiple gestation is a risk factor for premature delivery. Obesity, infections such as vaginal infections can cause premature delivery, and smoking is also a risk factor. In the fetus, we have abnormalities such as chromosomal abnormalities and placental insufficiency. For the complications in the mother, most times whatever caused the premature delivery can cause complications in her. In the fetus, the most common complications are hypoglycemia, hypothermia, and hyperbilirubinemia. For the others, I'll take them system by system. So you have the central nervous system, you have apnea of prematurity, hypoxic ischemic encephalopathy, you can have retinopathy of prematurity, especially if oxygen was given. You can have intraventricular hemorrhage, and later is cerebral palsy. For the respiratory system, you can have respiratory distress syndrome. You can also have apnea. For the gastrointestinal, you can have necrotizing enterocolitis, especially if feeds were given. You can have hypocalcemia, rickets of prematurity. So for the hematologic system, you can have anemia of prematurity, you can have thrombocytopenia, and then hyperbilirubinemia. They're also prone to infections. Sepsis is common in them. So for the management of a premature infant, once an infant is born premature, he's at risk for hypothermia. So the first thing is to put him in an incubator. If an incubator is not available, the mother or the father keep him skin to skin to provide warmth. That's called the kangaroo mother care. So the hypoglycemia, if the infant is very low birth weight or extremely low birth weight, most times breast milk is not advised, so they are giving intravenous fluid. On the first day, they are giving dextrose water, no saline, and then subsequent days, you can give them dextrose saline of different strengths depending on the weight of the baby. Hyperbilirubinemia, they are always prone to hyperbilirubinemia, so you put them under phototherapy light. But if the rates are rising and it's getting to the benchmark for kernicterus, you have to give them extreme blood transfusion to reduce the bilirubin level in the blood. For other symptoms, depends on what the baby comes with, but if there are risk factors for infection, you can give them antibiotics for 14 days, intravenous antibiotics. The other symptoms are managed per child. So breast milks are commenced when the child is stable, has attained a minimum weight of at least 1.8 kg, and then there are no other problems like apnea. Then you can start breast milk and teach the mother how to do that. For the follow-up, the mother is taught how to breastfeed the baby, how to care for this baby. They are seen in clinics regularly. Their developmental milestones should be checked in clinic by the attending physicians, and then they should have their immunization. Once their antibiotics have been completed, the baby is doing fine, they can now commence their immunization normal schedule as corrected by their age. And then you can also have to do a fundoscopy to rule out retinopathy of prematurity, especially if they stayed in the NICU for a long period. Thank you very much.
Good morning, my name is Ojanomare John. I'm a 500 level medical student. I'm here to give a short teaching on prematurity, and I'm going to be using the outlines as follows: definition, risk factors of prematurity, complications of prematurity in parents and child, management of prematurity, and follow-up. Definition: prematurity is a condition whereby a baby is born before 37 weeks of pregnancy. Many premature babies weigh less than 2.5 kilograms, that is underweight. The incidence is about 10 to 12% of all live births, and it is a major cause of neonatal mortality globally. Stages of prematurity. The stages include extreme preterm, very preterm, moderate or late preterm. Extreme preterm is before 28 weeks, very preterm between 28 to 32 weeks, moderate or late preterm 32 to 37 weeks. Risk factors for prematurity. The risk factors are categorized into the maternal risk factors, pregnancy risk factors, and fetal risk factors. The maternal risk factors include infection, bacterial infections such as streptococcal group of organisms, drug use, cocaine, abnormal structure of the uterus, previous prematurity, smoking. Pregnancy factors. The pregnancy factors include polyhydramnios, too much fluid during pregnancy, low-lying placenta, that is placenta previa, cervical problems, that is cervical incompetence, preeclampsia, which means high blood pressure and protein in urine, fetal factors, multiple gestation, twins, triplets. Complications of prematurity. Complications in the neonates. Temperature instability due to low body fat and thin skin, poor glucose control due to underdevelopment of the liver, respiratory problems due to inadequate surfactant, hypotension, low heart rate, reduced red blood cells, yellowing of the eyes, which is known as jaundice, due also to underdevelopment of the liver, bleeding into the brain, poor muscle tone due to underdevelopment of the brain, complications in parents, emotional stress, grief, anger, depression, anxiety. Management of prematurity. Management of prematurity includes the following: temperature controlled beds to maintain adequate temperature, steroids, the use of corticosteroids, which helps in the maturation of the lungs and helps also to reduce the risk of death, use of mechanical ventilators, magnesium sulfate, which has been found to be neuroprotective. It protects the brain from damage. Kangaroo care. It's a method of care for premature babies using skin-to-skin contact with the parents to provide contact aid and aid parent-infant attachment. This has been found to increase the bond between the parents and the premature neonate. Placement of catheters into the umbilical cord to give fluids and medications. This is very essential due to the underdevelopment of the guts of the premature neonates. Parental support. Close supports to parents should be adequately facilitated. Follow-up after discharge should also be taken into consideration. Adequate counseling of the patient should be done at every stage of care of the premature neonate. In conclusion, prematurity is a burden in the developing world due to inadequate facilities. The mortality rate is very, very high, unlike the developed world where facilities are readily available and the survival rate of premature neonates is high. Thank you for listening.
Good morning, everybody. My name is Ude Ezinne. I'm a 211 medical student at the Article University Okofia, Navy, and I'll be talking on prematurity today. Normally, gestation is meant to last for 40 weeks, and if a child is born before 37 weeks of gestation or pregnancy, the child is termed preterm. There are 4 stages of preterm birth. We have the late preterm stage, between where child is born between 34 to 36 weeks. We have the moderately preterm stage, where child is born between 32 and 34 weeks. We have the very preterm stage, where the child is born at less than 32 weeks, and we have the extremely preterm stage, where child is born at or less than 25 weeks. Now, statistics have it that the African woman is twice as much susceptible to preterm birth than white or Hispanic women, and therefore it has brought about a clarion call to try and give interventions to preterm birth, especially for the African society. There are risk factors that predispose a woman to having preterm birth. At the very top of this is previous preterm births. We also have miscarriages and abortions. We have smoking and illegal use of drugs. We have physical violence, domestic violence, stress, trauma, and the likes. We also have high blood pressure and diabetes. We have and so many other factors that predisposes the woman. And also complications that arise in mother and child as a result of preterm birth. We'll talk about that of the child first, which is divided into long-term and short-term complications. Now, the short-term complications include breathing problems due to underdeveloped lungs and lack of surfactants, which is responsible for the expansion and contraction of the lungs. We also have hypothermia, temperature problems, temperature regulation problems that can lead to hypothermia, which is low body temperature. And we also have immune problems because the immune system is not properly developed, and blood problems like anemia and jaundice. We also have problems like intraventricular hemorrhage, intraventricular bleeding, which, if not managed properly, could actually lead to long-term problems or complications of preterm birth. Long-term complications, on the other hand, include cerebral palsy, impaired hearing, vision loss, and the likes. And these effects are long-term. Then there are also effects to the mother of the child, and the family as a whole. We have postpartum depression, postpartum anxiety, stress, lack of positive feelings towards the child, impaired mother-child bonding. And in order to combat these effects, the WHO has given 3 key points of action, which include midwife-led continuity of care, where a midwife or a medical personnel is assigned to one family and to guide them through the period of the care or management for their preterm child, as opposed to the previous many families sharing one personnel. Then we also have kangaroo mother care, where the child is strapped to the body of the mother for warmth and feeding, which also helps, and it also helps propagate mother-child bonding. Then we have special clinical interventions like thermal care, feeding support, and safe oxygen use. I hope we've been able to learn a few things from this little talk of mine. Thank you.
Good morning, my name is Isomah Hanson, 511 Medical Center, University of Port Harcourt. I'll be making a presentation on prematurity. Prematurity usually is when the normal gestation period is less than 37 weeks. Okay, and when this happens, you have what will now result to low birth weight infants. Sometimes that are less than normally. The normal range is about 3,500 to about 4,500 grams. This about so when it is less than 2,500 grams, and then you can the birth weight decreases, and then it becomes very low birth weight infants to about 1,000 grams. So that is just the thing. So we have different presenting risk factors that can increase. You can have preeclampsia, multiple gestation, infections, okay, and so many other factors or nutritional factors that can ensure that a baby is born premature, or that lasting up to the expected 39 to 40 weeks gestation period. The cause of neonatal and infantile death in both developed and developing countries such as the US and Nigeria. Okay, a lot of money is spent on the management of these newborns and infants. Okay, but we're talking about the risk factors that the high risk factors of preterm delivery. We have the maternal factors, which is less than 20 years for the mother, height that is less than 155 cm, post-economic status, heavy workload, poor nutrition, and then single mothers. So factors carrying a high risk for preterm delivery, the obstetrics factors have prematurity, which is just giving those that have carried pregnancy more than 24 weeks for the first time, preeclampsia as a hypertension of pregnancy, antepartum hemorrhage, chronic ill health, smoking, previous history of preterm delivery, those that have had previous. Under fetal, we have multiple pregnancy, congenital abnormality. Multiple pregnancy increases the chance of preterm delivery by 30%. Okay, and then when it comes to the gestational age, it decreases by 2%. So for every number of pregnancy, number of fetus that's being carried, it decreases the number of the duration of the gestation by 2 weeks. Okay, we also have congenital anomalies such as Down syndrome and other infectious diseases such as congenital rubella. Problem associated with preterm infants. We have respiratory, GI, cardiovascular, metabolic, and hematologic problems. We have under respiratory, we have recurrent apneic spells, respiratory distress syndrome, pulmonary hemorrhage. Under GI, we have GI function. Under cardiovascular, we have patent arteriosus. Then under endocrine and metabolic, we have hypoglycemia, hyperglycemia, body temperature. Of course, we know that preterm infants have vasomotor instability. Okay, and then hematological and anemia and jaundice because of their premature liver. Okay, problems associated with preterm infants under CNS, we have seizures, retinopathy of prematurity, deafness, hypotonia. Under renal, we have hyponatremia. Under infection, we have sepsis, meningitis, pneumonia. Some factors, okay. And then the factors associated with small gestational age, we have congenital malformation, uterine twin with breast aphasia, and then long term we can have cerebral palsy, deafness, blindness, chronic lung disease, epilepsy, okay, and then other congenital disorders. Under management, we have to take a detailed history, physical examination, appropriate investigations, prompt decision of therapy, epilepsy, okay, and then other congenital disorders. Under management, we have to take a detailed history, physical examination, appropriate investigations, prompt decision of therapy, maintenance of normal body temperature. You can add them in incubators. Thankfully, we have the NICU, ventilators, total parenteral nutrition, and surfactants that have increased the survival rate of preterm infants. Okay, but make sure that your under management principles have to take a detailed history, physical exam, appropriate investigations, prompt decision of therapy, maintenance of normal body temperature, use your incubator care, your blankets, and your calorimeter. Under management principle, we have adequate food and calorie intake, breast milk, gastric tube feeding, duodenal tube feeding, prevention of infection, hand washing and sensible use, and then proper follow-up should also be taken care of. Correction of metabolic and other derangements like hypocalcemia, hypoglycemia, management of jaundice should also be done. Cost care, normally in the US it takes about $4,800 to $58,000 to take care of a preterm infant. Okay, so it costs a lot. They require special attention as a result of advanced medical tech and non-medical. There's a rate of survival and increased cost. Components of care of medical care, cost to the family, extra time, emotional, psychological, cost of traveling to the hospital. Also, we have to factor those in. Prevention, primary prevention, health education of the adults, institutional interventions, change in lifestyle behavior that are detrimental to the babies. Secondly, prevention, we have prenatal care, screening and treating mortality, screen for medical risk-related conditions like substance abuse, food supplement for pregnant women, encourage fathers to attend antenatal care with their wives. Another tertiary care, we have directed at ameliorating long-time sequelae, time use of prenatal corticosteroids, good neonatal intensive care, identification of those in need of monitoring, resources to ensure that those disabled children receive the health, education, psychological and social services. Under treatment, we have incubator, minimal handling, feeding, fluid management, treatment of any problems. Under conclusion, ensure you do your hand washing. Please remember to wash your hands before and after examining the baby as a physician or as a doctor. Thank you very much.
Hi guys, today is World Prematurity Day, and as a result of that we'll be discussing prematurity. Today is the 17th of November. So to commemorate that, we'll discuss prematurity as a disease condition. First of all, we'll start by way of definition, and then we'll go to the risk factors, the complications, and then the management for prematurity. So by definition, prematurity is a pediatric emergency in which there is delivery of the fetus before 37 weeks of gestation. It also has these classifications based on gestational age and birth weight. Under the birth weight, you have things like low birth weight, very low birth weight, extremely low birth weight. For the low birth weight is when the child is less than 2.5 kg. For the very low birth weight is when the child is less than 1.5 kg, and then less than 1 kg for extremely low birth weight. We go to the complication, to the risk factors first. Common things occur commonly. We have premature rupture of membrane, you have multiple gestation, you have presence of birth defects, you have maternal infections like chorioamnitis, maternal conditions like eclampsia, preeclampsia, and all that. So we have the complications for the child. First, topping the list because of the lack of production of surfactants. You have respiratory distress syndrome, you have patent ductus arteriosus, or presence of other defects. We have anemia, sepsis, you have death bronchopulmonary dysplasia, you have hypothermia, neonatal jaundice. Then for the parents, that will be based on the economic and social aspect, because the child needs utmost care, and this can take a strain on the parents and finance. Then for the management, care has to be taken as regards to the complications of the disease. So the management revolves around these complications that will most likely cause mortality or morbidity in the child, which revolves around temperature regulation, feeding. Care has to be taken with monitoring of the fluid of the child to check for dehydration, overhydration. For neonatal jaundice, you manage if the child is jaundiced. If the child has hypothermia, if the child has anemia, you manage. If the child has sepsis, you manage accordingly. Thank you very much. Happy World Prematurity Day. Respiratory distress syndrome, you have patent ductus arteriosus, or presence of other defects. We have anemia, sepsis, you have death bronchopulmonary dysplasia, you have hypothermia, neonatal jaundice. Then for the parents, that will be based on the economic and social aspect, because the child needs utmost care, and this can take a strain on the parents and finance. Then for the management, care has to be taken as regards to the complications of the disease. So the management revolves around these complications that will most likely cause mortality or morbidity in the child, which revolves around temperature regulation, feeding. Care has to be taken with monitoring of the fluid of the child to check for dehydration, overhydration. For neonatal jaundice, you manage. If the child is jaundiced, if the child has hypothermia, if the child has anemia, you manage. If the child has sepsis, you manage accordingly. Thank you very much. Happy World Prematurity Day.
Good morning to you. My name is Isaac Satumari, a final year medical student from University of Maiduguri. Prematurity is defined as a birth that occurs before 37 completed weeks of gestation. It can be classified based on gestational age or birth weight. Based on gestational age, can be classified into low birth weight, very low birth weight, and extremely low birth weight. Based on gestational age, can be classified as late preterm, early preterm, and extremely preterm. Risk factors associated with prematurity includes maternal infections, interventions such as external cephalic version, low body mass index, which is BMI, and low parity. Risk factor complications of prematurity includes respiratory distress, retinopathy of prematurity, patent ductus arteriosus, bronchopulmonary dysplasia, late onset sepsis, necrotizing enterocolitis, and many more others. Management of prematurity basically involves resuscitation. Most very low birth weight infants need resuscitation at birth. Anticipated delivery of a preterm infant should be attended by a clinician experienced in neonatal resuscitation. Facilities for assessment and stabilization should be close to the delivery area, and monitors and resuscitation equipment must be readily available. Resuscitation should follow a stipulated guideline, which involves special considerations for this particular babies. Prematurity also has effects on the parents, that is the mother. It can bring about low productivity later on. That is, a premature mother has high tendency of producing low number of children in the next in the adulthood. Thank you.
Good morning, Dr. Fondu. Talking about prematurity under the headings definition, then the risk factor, the complications of birth both in the children's and in that of the parents, then as well the management of prematurity and follow-up. So by definition, prematurity, otherwise called premature birth, is when a child is being given birth 3 weeks before the expected date of delivery. So it's when a child is given birth at the 37th week as against the normal 40th week of gestation. So that's the definition of prematurity. And in this case, some risk factors that do cause prematurity is mainly when the woman that gave birth during the gestation life is engaged in some use of illicit drugs such as tobacco and some others. Then there can also be some obstetric factors that do cause it. That's talking about when the woman have some pregnancy complications such as having multiple pregnancy or having some histories of premature births. So that can as well be some risk factors. Then on the complications of prematurity, on the side of the children, the main complication is talking about the cerebral palsy, talking about the nervous issues. So the child is going to have some cerebral palsy as well, then also have some respiratory issues. Then in addition to that, you also get to have some vision problems, then some respiratory problems as well. Then on the side of the parents, due to the severe shock and the traumatic stress that they do undergo, they tend to suffer some post-traumatic syndromes such as anger, depression, and some others. Then on the management of prematurity is mainly managed by the injection of antenatal corticosteroid that helps in the production of surfactant that is needed in the respiratory mechanisms of the child. Then mainly the child is placed in an neonatal intensive care unit. That's where he will be receiving some treatments, receiving some fluids, some breast milk. That's in terms of the feeding side of it. Then talking about the follow-ups that is needed when a child is being born premature. First and foremost, the follow-up is mainly to keep a medical record or keep a journal, because it helps in visiting whenever complications do arise. Then most especially as well, you do need to follow up based on the respiratory management and as well based on the neurological management. So these are more the things that concerns prematurity. Thank you so much.
Favorite Dr. Temitope Afolabi from the University of Ibadan 200 level. It is estimated that about 50 million of babies are born prematurely every year, and the number is increasing year in, year out. So this makes prematurity worth discussion. So what is prematurity? Prematurity is a term used to describe babies that are born below 37th week of gestation. Normally, gestation should last about 40 weeks. So when babies are born below 37th weeks, they are considered premature. We have 3 categories. The first category, they are the extreme preterm babies. This one, they are born less than 28 weeks of gestation. We have very preterm. These are born between 28th to 32nd week of gestation. And we have moderate preterm babies. These are born between 32nd to 37th weeks of gestation. So what are the factors that predispose a woman to having a premature birth? Factors such as gestational diabetes, high blood pressure in pregnancy, preeclampsia, infection of the amniotic membrane, urinary tract infection of the mother can predispose the mother to giving birth prematurely. Also, abnormal uterus, multiple pregnancies. Factors such as stress also can predispose the mother to giving birth prematurely. Smoking, illegal use of drugs, malnutrition can also cause the mother to give birth prematurely. So now we know that the last weeks of gestation, it is very important for healthy weight gain of the baby and for functioning of vital organs. So if this is not attained fully in the womb, then there will be complications. Examples of such complications include neonatal respiratory distress syndrome. This is a breathing disorder caused by underdeveloped lungs, because normally the lung should attain its full development at the weeks like 37th weeks. Then we also have patent ductus arteriosus. That is an enclosed hole in the main blood vessel. We also have hypoglycemia, anemia, neonatal sepsis. The baby will be predisposed to infections. So what are the management of premature and follow-up? For you to have a premature baby and manage them, it could be cost demanding and time demanding. So they have to put them under incubator to protect them from the environment and provide adequate temperature for them. They also need to support their lungs by giving them oxygen or putting them under ventilator. We also need to feed them the essential nutrients either intravenously or intranasally, so as to acquire the normal development that they need. Other responsibilities of the medical teams include reassurance. We have to reassure the parents and also to educate them, to enlighten them on the condition of the baby and what are the things they need to do, how to pay special attention for the psychology development of the baby, to note when it is right time for the cognitive skill development. Some of them might need assistance. Some of the babies might also require psychological support while developing. So ladies and gentlemen, thank you for listening. I still remain Temitope Afolabi.
Good morning, ladies and gentlemen. My name is Abdullahi Mudatheer. I'm a 600 level medical student of Usman Danfodio University, Sokoto. I'm here to present on the topic prematurity in honor of Prematurity Day, which is today, the 17th of November, and it's in respect to the guideline given to us by Dr. Ofondu, which will go by the following outline. The first is the definition, then we'll give the risk factors for prematurity, then we'll talk about the complications of prematurity both in the child and in the mother, we'll talk about the management and subsequent follow-up. Now, by way of definition, prematurity is defined as the delivery of a baby less than 37 completed gestational weeks, and as we all know, the age of viability ranges from 28 weeks, so a child that's given birth after 28 weeks is likely to survive. However, if he's given birth to in less than 37 completed weeks, such child is said to be a premature child. Now, some of the risk factors could be divided into the maternal risk factors and the risk factors in the fetus itself. Now, the associated maternal risk factors could be, as we commonly see, they said low socioeconomic status, which is the case usually in developing countries. There are other risk factors such as maternal disorders, like if they have uterine malformations, it can lead to the baby not able to reach term. Now, other disorders include cigarette smoking in mothers and substance abuses in the mothers also, while other factors could include maternal illnesses such as hypertensive disorders in the mother, diabetes in the gestational woman, and so on. And also a sickle cell disease patient mother can also be a risk factor for prematurity. Also, a prior history of prematurity could also give to the tendency of having other subsequent premature deliveries, and also the gestational age of the mother. If the mother is less than 16 years, or in some places greater than 35 years, which is a range less than 16 or 35, it will also predispose her to premature delivery. And also, when there is history suggestive of multiple gestation in a woman, it could also predispose her to prematurity. Now, for the fetal risk factors, some of the common fetal risk factors include when there's a fetal distress, it could lead to prematurity, and when there's intrauterine growth retardation, could also lead to prematurity. Now, some of the complications these children could have when they are given birth prematurely include, for the central nervous system, they could have an intraventricular hemorrhage, which could predispose to lots of problems. They could also have periventricular leukomalacia, that's for the central nervous system. For the cardiovascular system, they could have patent ductus arteriosus, while for the gastrointestinal system, they could have stuff like hyperbilirubinemia. They could also have necrotizing enterocolitis, and they could also have feeding abnormalities. Why? Because their GIT is not fully developed. Then for the renal system, they could have renal tubular acidosis, and for other metabolic disorders, they could have hypoglycemia, hyponatremia, and most of the hypos that we know about. For the hematologic system, they could have anemia, while for the hematologic system, while for the respiratory system, they could have respiratory distress and apnea of prematurity. Now, the principles of management of prematurity include the principles. One is that you have to do adequate thermal control. Why? Because these children are at risk of hypothermia. As such, you need to maintain an optimal temperature in these children. Then that's by keeping them in an incubator so as not to have excessive fluid loss. Then secondly, apart from thermal control, you need to also have adequate fluid control. For adequate fluid intake should be given to the child so as they won't lose much of the electrolytes they already have, and they also need adequate nutrition. Adequate nutrition is an important factor. Why? Because they are at risk of hypoglycemia. And then also infection control. Why? Because their immunity is not fully matured. As such, modes for infection control should be instituted so they won't go into infections and also develop sepsis. And then lastly, you need to encourage mother and child bond so as to improve the child emotional stand, while as well as the mother stand. Why? Because for mothers that have had premature delivery, it's difficult to cope. As such, you need to encourage that mother to child bond so that emotional support will be there both for the mother and the child, and also there will be that psychological balance for the child. Thank you very much. Happy Prematurity Day.
Good morning. It's November 17th, World Prematurity Day. So I'm here to talk about prematurity. This can also be called preterm. A pregnancy normally lasts for 40 weeks. So any baby born alive before 37 weeks are completed is a premature baby. It is extremely premature when the baby is born before 28 weeks of gestation, and late premature between 30 to 37 weeks. Risk factors include multiple pregnancy, chronic diseases, but in most cases, premature birth occurs without a cause. There can be complications like difficulty in regulating body temperature. Then the lungs are also immature at this stage. This may lead to infant respiratory distress syndrome. There can also be poor feeding, slow weight gain, and also retinopathy of prematurity. This affects the retina and may lead to blindness in extreme cases. Premature birth is a very traumatic experience for the parent of the child. It may even lead to depression due to fear and anxiety. To manage this, first, baby is taken to the intensive care unit where necessary tests are carried out. The breathing and the heart rate is monitored. Then the fluid input and output levels are also measured. Then blood tests are carried out to assess the red blood cell count, to assess for infection. Blood tests are also necessary to monitor critical substances like calcium, glucose level, and bilirubin. Then the baby is put in an incubator for regulation of temperature. Fluids are delivered through intravenous methods. Surfactants and antibiotics are administered if necessary. Prematurity is not a death sentence. If the baby is properly taken care of, the baby will grow up without further complications.
Everybody, good morning. Today is World Prematurity Day. I am Eborah Emeka, a 411 medical student of the University of UNIUYO. Today we'll be talking about World Prematurity Day, which holds every November 17th of every year. The theme for this year's own is Together for Babies Born Too Soon, Caring for the Future, says the theme. So here's my outline I will be looking at today. So as a way of introduction, World Prematurity Day is being celebrated since 2009 inception. It's an occasion to mark out the huge weight of death that is seen in them, the pain, the suffering from preterm birth. Definition of prematurity by WHO, it says live-born infants delivered before 37 weeks from the first day of the last menstrual period. Some classification is the preterm, the very preterm, the moderate to the late preterm. This classification is done based on the gestational age. Now, the incidence, Nigeria is among one of the countries with the highest prevalence, is the third in number. And as of 2019, this was the figure. Nigeria recorded. So how do you know a premature birth? Most times they present with small size body stature, sharp looking due to the lack of fat stores. They have fine hairs, which we call onugo. You notice some low body temperature when you take their temperature, labored breathing, and lack of reflexes. Now, the risk factors involve, not all women have known risk factors, but the common ones we know are previous preterm births, multiple pregnancies, anatomical anomalies of the reproductive system, substance abuse, some infections, some chronic conditions, being underweight or overweight before pregnancy, multiple miscarriages, physical injury, and it's worthy to note that pregnancy complications can result in preterm birth because the baby has to be delivered early to reduce further insult. These are the complications of prematurity. I would like to group them into the acute and the long-term ones. The acute one try to show up few days after the of delivery. They include breathing problems which can stem from respiratory distress syndrome, bronchopulmonary dysplasia. There's also apnea of breathing, that's pauses while breathing. There are some heart problems like repeated ductus arteriosus. These are heart defects, brain problems, temperature control problems due to lack of body stores or fat, and GI problems from necrotizing enterocolitis, whereby there is the bowel wall cells are affected. So that can lead to sepsis and then the death of the baby. Some blood problems like anemia and jaundice are noted. Metabolism problems are shown to have most of the time low glucose level, that's hypoglycemia. Immune system, they are not able to fight pathogens at an early time since they did not stay longer in the womb. So long-term complications are cerebral palsy. Cerebral palsy is a movement disorder that has to do with movement disorder that can be caused by prematurity. Another causes include less blood supply to the brain, like you see in utero placenta insufficiency, some chromosomal anomalies, and structural problems. These children can develop long-term complications of impaired learning, which it has been shown statistically to have a high incidence, vision problems from retinopathy of prematurity due to proliferation of blood vessel layers as a result of hyperbaric oxygen. Sometimes it can be caused by hypoxia, hypercapnia even. Sometimes this retinopathy can cause scarring of the retina and then detachment from the wall when they are pulled. These children can also develop hearing problems, behavioral and psychological problems, chronic health issues. Now, the complication on the parents, as these children needed more intensive care, so there might be this last bonding of the mother to the child. So that's a problem. Prevention of frequent preterm deliveries. It has been shown that women with frequent preterm delivery can benefit from progesterone supplements. For women who have short cervix and the history afterwards is good. There's another surgical procedure called cervical cerclage, whereby you suture the cervical os. The two known methods are the McDonald method and the Chilaka. That will be done some few weeks after conception, and then they will be removed at 10. Now, management of prematurity. There is supportive care, the medications and surgery. Supportive care include things like giving fluids, putting them incubated so that they can maintain good temperature. Medications you can offer are corticosteroids to improve the production of surfactants to help the lungs to expand, and then that can even lead to the narrowing or the constriction of the PDA, that's the repeated ductus arteriosus. You can give diuretics to produce more fluids. Surgery are indicated in some. And so that's the end.